morning and welcome to Vantage Point. I'm Marcia Boyles, and as always, I'd like to introduce my co-host and co-producer, Kathleen Taylor. Good morning, Kathleen.
Good morning.
Glad to have you.
Yeah.
In the course of our programs on Vantage Point for the last couple of years, we have talked a little bit about change. Certainly for residents, we know that change is something that's a constant in our lives, and many of the resident issues have involved change. On occasion, when we've talked about issues of aging, I have chimed in about some personal reactions, personal notes with regard to change. And today it is your turn to talk about change.
That's right. It is, and to share some personal information as well. That's right. By the way, Happy New Year.
Happy New Year
2018.
to you and to all our residents.
Yeah, absolutely. But yeah, we have had on this show lots of good conversations about things that just affect people as they go about their lives, and change is definitely one of those things that we're always having to adjust to and adapt to. And for me, this is actually an exciting change that's happening, which is that after 8 years of being the social work manager, I'm going to be transitioning to a role as the social worker in the medical center.
That's a brand new position.
That's a brand new position, absolutely. So I'm going to be doing some groundbreaking along the way, I guess, in terms of what that is actually going to look like. But it's something that I'm again really, really happy about, because it does sort of give me a chance to get back to my social work roots to a certain extent, because the reason I went into social work was really to be able to work directly with people during challenging times, to be able to provide that supportive counseling. And the other part that I've really done my whole life is the medical social work piece, to work with people when they might be having challenging times around a medical condition. So this is going to put me in a situation where I'm going to be able to do those things. Well,
now, Kathleen, you are a licensed clinical social worker.
Correct.
And tell us what that means.
Okay, so a licensed clinical social worker is a mental health professional, which means that I've had extra training in mental health counseling. And yeah, you're right, that's one of those things that I haven't really been able to fully utilize those skills with in my manager role.
Except for times when we go a little crazy.
Well, I always kind of do that informally. I mean, that's part of who I am. I have those skills and I do use them.
And folks do tend to go a little crazy, all of us sometimes.
Yeah. But it's really just about being able to utilize them in a more formal way.
And this is a certified. You're certified in some fashion, are you not? In other words, you have to keep up your license.
I'm licensed, right? Licensed through the state of Virginia as a mental health professional. So now I'm going to be able to do that as well. And I think
providing individual counseling.
Individual, also family, couples. I can do all of those things. So
all right.
I'm going to have lots of opportunity. I think that what I know about the medical center is that they're really looking to be able to address the needs of the whole person. So recognizing that it's not just physical symptoms that need to be considered when somebody comes into the medical center. It's also how they're doing emotionally, how it's impacting their life in many different ways. So I think that is where the social work position is really going to add to the medical practice at the medical center. And I know the physicians and the staff are really excited about being able to do that.
Will you be having then discussions with the physicians around certain issues with patients?
Well, I'm gonna be part of the team. So I think that what's going to happen, and again, I'm like not even a full week into it,
right.
And haven't really gotten settled in terms of being there all the time, but I'm going to be there as a resource, as a consultant. If the physician is meeting with a patient that might have some emergent needs, that person would benefit from having a consultation with me, then the doctor will reach out to me, bring me in. I'll be able to meet with that person right then, and then also be able to set up some ongoing sessions if that's indicated.
Kathleen, tell me about financing. Does Medicare and Medicaid cover mental health counseling?
Yeah. It does. So that is something that that we'll be able to do, is bill a resident's Medicare, or whatever, if they have a private insurance that is maybe not Medicare, be able to bill for mental health services specifically. Yes.
Okay. Currently, there is one provider, I think, mental health provider, Pat Ferrari.
Yeah, Pat Ferrari has been our mental health provider, nurse practitioner provider for a lot of years, and I think she and I are both, again, really happy to think that we're going to be able to provide more mental health services to the community, because it's just, so beneficial. It's just really something that improves a person's quality of life and sense of well-being. So if we have the ability to do that, Pat, I think, has spread pretty thin, because she is over in Garden Ridge, as well as seeing patients in the medical center.
Will you also be covering Garden Ridge?
I think that's really up in the air. I think right now the thought is that I'm going to be primarily dedicated to the medical center, but I know it's going to be a work in progress. I know that we're not going to have all the answers at the beginning, that we're really going to be feeling our way through.
You also indicated that you will be doing some work in independent living along with your social work team.
Yeah. Thanks for bringing that up. Yeah, I think that people need to understand that I'm not going away in any kind of sense of the word. I'm going to still be coordinating with the social workers that are in independent living in Garden Ridge, and in fact, I think I'm going to be more active in that role in terms of partnering with the social work team to be able to support the resident as best as possible. But I'm going to be able to dedicate all of my time to doing that, which again, I think, the social workers have been spread pretty thin as well. So this is another way to really to provide that extra, putting me back into the field again, as opposed to in a management position, is going to enhance that social work service as well.
Okay. Anything else?
I can't think of anything else. I think this is a good time for us to bring Crystal in. Crystal Estep is the practice administrator at the medical center. And she is, as we were talking about, just wanting to be able to support the resident emotionally, provide good customer service. She is really, really on board with that, and so I know we're going to be working together pretty closely. So I'd like to bring Crystal in right now, if I could.
Yes, indeed.
Because she can add to our conversation.
Come in, Crystal.
Good morning. Hi.
We're glad to have you. I think you've been on Channel 6 before occasionally, haven't you, Crystal?
Yes, just not with you.
Right, but you've been here talking about the medical center.
Correct.
Well, you've been at the medical center about 6 months, I think you said?
6 months on the 10th.
Okay, so you're still feeling your way over there.
I am.
How do you envision changes, the kinds of changes that Kathleen is talking about, and the integration of social work into the more holistic approach? Tell us about that.
I view it as a positive change. I know there's a couple Erickson campuses that already have a social worker. It is a new concept, although it has been working very well. Like I said, I do believe it's a positive change. We're excited to have Kathleen there to help out. I know that she will be busy. She will definitely be busy. Like she stated at the beginning, it's not just the well-being physically, it's the well-being mentally as well, that we want to take care of the person as a whole.
How is this going to be, how is that concept going to be manifest in terms of practice? Will we see changes?
I'm hoping we see changes. It like I said, it's all so new. We definitely will see changes. It's just so new, and we're trying to fill it out. Like she said, it's only been not even a week yet. I can guarantee there'll be changes. I hope we see them fast, but it does take time. So.
Yeah, I think it's part of the team approach. We're going to be using each other. So I think that, whereas the physician would want to be able to spend the time to kind of address those emotional concerns, they really don't have the time. So having me right there to be able to do that is really going to enhance the approach in terms of supporting the whole person. And I think that it's going to happen naturally, because I think the desire has always been there. It's just being able to do it.
Talk to me a little bit about the holistic approach. This certainly, we have certainly heard that as a concept, and I think it's been going on for quite a while. How does this look in other Erickson communities or in other group practices? How do they do this? Does a physician approach a patient differently to some degree if they're saying this is now part of our approach? Is there actually, will we actually sense a difference, do you think?
You will not sense a difference. That like we've stated, they'll take care of the physical needs. The only difference that we're going to see is that when you do have those other needs, that they can be taken care of right away instead of have time go in between. Kathleen will be on hand, that if there's stating an emotional need, like she said, the physicians don't always have the time to sit there and help out with the emotional needs like they would like to.
Right.
So they would come out and they would ask for Kathleen to go into the room and speak with the resident. So it's the change that I see is going to be a good change. It's not going to affect the care that you're going to get from the physicians. I believe it's actually going to enhance the care, because you will have everything taken care of at once instead of just the physical. You'll have the mental as well.
And more emphasis then on that.
Exactly.
Okay. It would also occur to me that in a totally holistic approach, you would want a dietitian available and, other kinds of support.
Yeah, and we do have those things. It's just they're not all, in the medical
in the
center,
same place,
but
right.
that's the continuum of care. We have the ability to pull a dietitian in. We have the ability to get, our physical therapy, your occupational therapy, your speech therapy. We have all of those resources. So that's definitely part of it too, is being able to, I'm probably, that's part of what I do, is being able to see how those resources would be able to support a person. So I'm guessing that that's probably also a little bit of what I'm going to do, because that's what social workers do, is being able to connect people with resources and services that are available and will be beneficial to them. So if somebody would benefit from home health or would benefit from a rehab referral, those would be things that I might be doing as well. Though, those are things that the doctors have been doing all along. It's just, again, it's just like, that's the team approach. We all make each other better, all make each other stronger. So, us being able to be that team is going to be just, I think, really important. And I know Crystal has, in her short time here already, done a lot in terms of being able to address people's needs in the moment if things have gotten frustrating for them in some kind of way,
The logistics, particularly.
The logistics, yeah.
Exactly.
Healthcare can be really frustrating. It's,
No.
We know this. We know this. It's just you come in, you don't feel well. Things aren't working the way. It was just hard to get to the medical center. Now maybe there's a little bit of a backup because somebody else came in unexpectedly. So that's all hard. That's really, really hard. And I know that Crystal is really aware of how hard that can be for a resident when they come in, and she's really working to be able to respond to that and get her staff to be able to respond to that in the moment. And I personally, because I have gone in and out of the medical center for a lot of years, have seen already a big difference in terms of just the atmosphere in the waiting room. So.
Oh, well, thank you. We have a good team.
Yeah.
We have a good team.
I think we residents are seeing it as well, that that things seem to be moving along much more smoothly than they were 6 months ago or a year ago.
Well, thank you. Like I said, it's a team effort, and I'm very excited to add Kathleen to the team as well. It's only going to get better. 2018 is going to be a good year.
Crystal, when you and I talked several days ago, you indicated that you had some ideas for things that you would like to see done fairly quickly. Do you want to talk a little bit about some
I thought those were top secret.
We like to have breaking news on this show.
Exactly.
So breaking news.
We like to think we're on the cutting edge.
That's right.
There's a lot of ideas that we, as the medical center, I've spoke with physicians. These aren't just my ideas. They've come up with having meetings with the physicians and the staff as well. Is in order for us to educate residents about exactly what care they can receive at the medical center, what our physicians are like, we'd like to do more education. Not only more education, we'd like to set up meet and greets to where the residents can come down, and not in the medical center. We want it in a hall, have coffee, tea, some snacks. The residents come down and actually physically meet the physicians and talk to them and fill them out, and see if it's something they would want to do is come to the medical center and what physician they would like to see. I think it's hard enough going to a new physician, being nervous, walking in and not knowing the personality is going to fit. And we don't want residents to be afraid to say what they really feeling or what they mean. We don't want the uncomfortableness there, and sometimes it is. You go to a physician you don't know, and you don't really put everything out there on the table because you're already uncomfortable with the physician, and it's just personality-wise. We want the best care possible, so we're definitely going to do meet and greets to where you can come meet the physicians. Hopefully we're going to have a panel to where you can ask questions. And then you will see the staff around as well. Like I said, the medical center has kind of been in the background for a while, and we're not going to allow that to happen anymore. You will see us out and about. We're going to do individual videos. I just talked to Diane on how to do that. We want to do bios of the physicians so that it's on the TV as well, stating their backgrounds, where they come from, what their practices were prior, and what they have to offer now. And we're going to do it with the staff as well. So when you walk in, you know about the staff, you know how much experience they've had in the medical field, because it is. The medical center is, any medical center is a scary place.
Yep.
It really is, because you want your needs met, and you want the experience, and you want to know where everybody comes from that's taking care of you. So there's a lot of ideas that we have that's going to come out in 2018, so watch your cubbies, because we are going to stuff them.
Yeah.
I was pleased to see I think it was several months ago now, a sheet from you all that had the pictures and a little bit of information about each of your physicians. And I thought that was really a positive thing.
Yeah,
So.
I think Crystal and I are definitely on the same page in terms of looking at healthcare as a partnership.
Exactly.
And that's going to be based on relationships that you build with the medical center as a whole, and then as you're with your provider and other staff that you're in contact with. So, and part of that partnership is that you have the patient has an equal part and an equal responsibility in their health care. So those are things that we're going to want to start talking about too, is what's the role of the resident in being able to get the best health care possible. You know, what are their responsibilities in coming into an office visit with the doctor. You know, what information do they need to bring with them, for example, to be able to help the doctor to be able to give the best care that they want to be able to give. So that, I think that all in all, it's just, instead of seeing the medical center and the physicians as sort of apart, you know, and sort of everything's working behind the curtain, you don't really understand what's going on. Crystal really wants to be able to, and I definitely want to be able to give that information and give that education to the residents so they really understand the process and, again, understand their part in the process as well, because that's going to help the residents feel much more in control of what's happening, which from a mental health standpoint is optimal. You know, people need to be able to feel like they have a say in what's going on, that they understand what's going on, and that they have control at some level. So those are all of our goals. And again, the physicians are totally on board with that, because they know that an informed patient is the patient who's going to be able to do better.
And clearly, if the patient is sharing the information with physicians, the outcome should be, I mean, it should be a stronger team all the way around.
Absolutely.
I think that's excellent. Kathleen, you and I and Crystal, you, I think, overheard some of this conversation, have talked a bit about the possibility of trying to do some skits.
Oh yeah.
We have a show called That's Life, which has centered on the relationship between residents and social workers.
Yeah, and the whole point there was to be able to show people what it looks like to have, you know, a conversation with your social worker. What would some of the topics be? You know, what would the interaction look like? And I think that there would be, you know, definitely a value to being able to do that in terms of, well, you come in to see your doctor, you know, what information, we like to do worst case scenarios, so if somebody comes in and, you know, has no information, and we always like to have the person bring somebody with them if possible, just because, you know, it's really nice to have that second set of ears. Yes. You know, just those kinds of things. What could kind of go wrong versus what would be the kind of right outcome that you would want to have. So that could probably be something cool we could do.
Why do skits? Just follow me around with a camera for a day.
Well,
you'd have all the skits you need.
Confidentiality, maybe.
Exactly. Exactly.
But so yeah, I think that those are things that we can do. I think it's just really sort of demystifying healthcare, demystifying the healthcare setting.
Oh, I like that phrase. Yes, I think that explains a lot, because the medical center, just medical attention, medical practice really is, I think, mystifies many of us on occasion at least. So I think that's excellent. Crystal, anything else you'd like to share with us this morning?
Just that we're excited to have Kathleen come on board, and like I told you the other day, my door is always open if you have any questions of what Kathleen's role is, what the role of the medical center is, any questions whatsoever. Anybody's more than welcome to stop by and just ask for me. It's an open door policy, and I know some people aren't going to understand the whole scenario of what Kathleen's role is going to be, so I would like to make it clear. So if it's not clear, they're more than welcome to stop by.
Yeah,
I'll take the time, sit down, and we'll explain it to them.
Yeah, and you know, absolutely, that people can contact me too. I know that as the word has sort of gotten through the community that I'm going to be changing my positions, people are definitely coming up to me and asking me, you know, what I'm doing, you know. But I think, as I've told you, the main thing that people are asking me is this good? Is this something that you want to do? Yes. And so for all the people that have sort of watched us for the last 2 years on Vantage Point, and what did we say, almost 4 years on That's Life, and have gotten to know me, I think, some people better on television than in real life. This is something that, as I said at the beginning, is something that is really going to allow me to do everything that I would want to be able to do as a social worker, really practice my profession as fully as possible. So I am really happy about it. right now I'm sort of in the process of moving my office over to the medical center, so I'm still part-time in Village Square, in my office in Village Square for a while. So if people see me in the hall or want to drop in as well, just to talk, and otherwise they'll run into me at the medical center, I hope.
Well, Kathleen and Crystal, I can't say that we're happy to be losing you as the social work manager. You have been just wonderfully professional and kind with residents. I think you have there's great admiration and affection on the part of both the residents and your social work staff.
Thank you.
We are going to miss that, I will confess. On the other hand, I think the medical center certainly will absolutely benefit with Kathleen's input, and I'm glad that you're glad
Yep.
that you're going to be doing that, Kathleen. That's always a positive thing to say as well. So I think with that, unless either one of you have anything you'd like to add here.
No, I think we're good, and I think we're going to make sure that Crystal and I are on Village in Motions or more Vantage points or something, so that we can keep people updated and how we're progressing.
All right. Well, I think that sounds good. The fact that we will continue our programs. We might just remind folks that we do have a community forum coming up next week on Thursday, January 11th, is Exploring Your Legacy. So for those of you who haven't read your cubby contents yet, take a look at this forum.
Yep.
I think with that then, much good luck.
Thank
and to you too, Kathleen.
Thanks.
I think the medical center will absolutely be a stronger place as a result of this move.